Well, hello, my beautiful friend. Welcome back to the podcast. And today on the show, I am so super excited to have my friend and naturopathic doctor on the show, Dr. Kendra Etzel. Hi, Dr. Etzel.
Hi, I'm so happy to be here. Thank you so much for having me.
Absolutely. And just to give a little bit of background about you, you are a naturopathic doctor here in the San Diego area. And I've been to you a few times as a patient and have appreciated so much of your education and your knowledge. And that's why I was so excited to have you on the show today. I know you specialize in regenerative medicine. You have a clinic for that. You specialize in hormones, which is something we'll talk about here today. And that's something I saw you for, as well as just anti-aging and longevity practices. We have gone for walks together on the beach, and I just have appreciated your education and your openness to talk about so many areas of our health that we're just missing in today's society, and maybe we just haven't been informed. So thank you for educating me and having you here today to educate my audience. So I want to start off, I think a good place would be, what was your reason for wanting to go into naturopathic medicine?
Yeah, that's a great question. So I can tell you that it wasn't planned. So it honestly just stemmed from sort of my own struggle that I had. Looking back, I really had hormone issues from an early age. When I was in my 20s, however, I was studying to go to medical school. I really wanted to be a medical doctor. I started having hot flashes. I had acne. I had significant depression and fatigue, all worse around my cycles. Especially the hot flashes is something that's a little bit unique. But obviously, I went to my medical doctors. I was part of Kaiser at the time. And my viewpoint then was like, okay, great. These medical doctors are going to help me figure out exactly what's going on. They're there to fix me and help me and educate me and make things better. But I go to Kaiser and, they rule out cancer, other things when someone has hot flashes. And my intuition was really that it was hormonal, especially with the fact that symptoms were always worse, really around my cycle. So I see the hormone specialist at Kaiser, and it's a man, and I'm kind of telling him, like, this is different. I know what depression feels like because I've had that pretty situational for parts of my life, but this is different. And it was just really my intuition that was telling me that. After I spent a few minutes talking to him about how I felt, he basically just looked back at me and he said, I think you're just depressed and you need more antidepressants.
Mm-hmm.
And that kind of shattered a little bit of my sense of what doctors were there to do. Again, it was likely just me being naive, but I really thought that he was there to really help me and listen. And I had the courage to say, well, can we at least look at my hormones? And I'm really glad I advocated for myself in that way. And you'll learn as a woman, oftentimes you really do need to advocate for yourself in these situations. So I said, can we test my hormones? He says, no. The only reason we test hormones is if you're pregnant and you're much too young to have hormone issues. I was really just stunned and shocked. And we know now that that's not the case, that women certainly have hormone issues from the time they start having cycles. So many women now don't have menstrual cycles. And so I was a little bit desperate. I didn't know about naturopathic medicine. I didn't really understand the foundations or the principles of it. Honestly, I thought that it was for people who didn't want serious careers, which is awful to say, but that is how I felt at the time. And it was really out of sheer desperation that I found a naturopath, and she was willing to listen, and she tested my hormones and she said, hey, these are off. You have the hormones of someone who's in their 40s. You're in your 20s. I don't know why, but here's kind of some of the lifestyle things that I think you should do. I did have a little bit of high insulin levels, not terrible, but I really at that point started to clean up the things I could control, right? My diet, my exercise, my stress management. I really made a focus to work on those things. Things kind of got better, not so much so though, but I decided from that experience, because she listened to me so much, she was really there and willing to kind of help me at least figure out what was going on, even though she didn't have all the answers. That led me to want to go to naturopathic medicine. I wanted to be a doctor who got to the root cause, who helped patients heal, who did a lot of education, someone who really support patients. Because when you're sick and you don't feel good, most of us know that's a scary place to be. And you want the right people on your team who are going to care and are going to help you figure it out. And so I would kind of go on. So I go to naturopathic medical school and I'm still having really irregular cycles. Sometimes I wouldn't have them for months. I had a lot of weight gain and significant insomnia. So all the other issues were still there. I didn't have any signs of PCOS, which is interesting. That's sort of the most common cause of infertility currently and a very common issue that younger women face with regards to hormones. And I didn't have those symptoms. But after medical school, I made it through. I was kind of noticing that I couldn't do a lot of the things that my friends could do. I wasn't sleeping well. I could get through school and that was fine. But then at 32, I was studying for my final medical board exam, doing all the things you're not supposed to do. So often I'll tell my patients, don't do what I did. So I'm 22. I'm under a lot of stress because I'm studying for my final medical boards. I'm doing 24-hour fasts consistently. I'm competing CrossFit. I'm really doing what medical doctors say to do when you want to lose weight, which is exercise more and eat less. And I check my hormone levels and I have no detectable levels of estrogen. My estradiol was non-detectable, which is that, main female hormone. And so at 32, I was pretty devastated. What that means is that I had something called premature ovarian failure. Now they call it premature ovarian insufficiency. But I was really devastated because losing hormones like that at such a young age can actually impact your life expectancy. So it reduces your life expectancy when you don't have the hormones there to protect your heart and your brains and your bones. Usually it's from a rare genetic disease. It could be surgical. It could be from chemo or radiation. And I knew I had none of those. It was likely one of those instances where I really did shut down my own hormone production through stress. And I think I had a little bit of a harder time with hormones from that early age. And we'll talk about that in a little bit, I'm sure. So what I decided to do was replace my hormones at that time. I was in a stressful residency and just starting my career. So I chose to do a type of hormone replacement called physiologic restoration. Basically, I was restoring my hormone levels to what would naturally be happening in my 30s. So I did have periods again. And I can say that within the first few days of starting hormones, I felt like I had my life back. I felt like I really slept for the first time in what seemed like 10 years because we really need those hormones to really calm that nervous system. And I could go out with friends again. I could socialize. I wasn't just completely exhausted after work. I started to find more joy and excitement in my life. And I really needed that. But when all this really happened, it put me into high gear because I needed to figure out why this happened, how this happened, how am I going to help others? Because I really felt called, especially at this point, that this was my journey of health that I could use to help other people. So that's kind of a long story, a long answer for you is kind of how I got into this. It just wasn't planned.
Yeah. And I feel oftentimes people find their purpose in life through their pain. I know I got into podcasting and doing this because of my painful over drinking habit that I couldn't figure out. And then once you figure it out, it's like, oh my gosh, now I have to tell everybody and I want to devote my life to this. So
your wounds really can create that wisdom and we're here to serve and help other people. So
I love that. Why do you think it is, just hanging out with you and learning from you. It's such a different world in this functional medicine, integrative medicine, naturopathic medicine space than traditional medicine, where I was trained as a pharmacist, where we shut down the conversation around hormones. Do you have any idea why I feel their hormones and testing hormones are dismissed or not taken seriously, or they use the term gaslit, just not being heard by female or male physicians and just shutting down that whole conversation? I mean, I remember going to just my OBGYN. She's highly credentialed. She's got all the great star reviews. That's why I chose her. And when I brought up the conversation around hormone therapy, she's like, oh no, that causes breast cancer. Those are dangerous. We don't want to go that route. Here's an IUD. Just kind of taking that conversation in a way that I don't feel was representative of the total breadth of data we have around hormones, and almost an uneducated way that there's all this information about bioidentical hormones, all this information about testing for hormones. And you've experienced it where it's changed your life. I've experienced it where it's added so much more energy and positivity to my life when I was struggling. And why do you think it's just not embraced by traditional medicine?
I think that's a great question. I think you're right. Women don't get the care that they deserve. I think a lot of it has to do with a couple of things. One is sort of the nuance of hormones. Every woman is so different. So the amount of estrogen that's going to make your brain happy versus mine can be up to 1,000-fold difference. And that's across the board for women. We're all so very different, and you need to take an individualized approach. Our system isn't set up for that. They're set up for protocols, algorithms, for you to really fit into one box. And then there's a lot of books out there, and I encourage patients to form their own conclusions. But from my perspective, it really looks like the talk about hormones and being shut down the way they were and not being discussed is almost an attempt to kind of keep us as not as healthy as we can be, and I think as we should be, and encourage people to form their own opinions. And there are some really good books about this. So I think it's twofold. I think, again, it's the complexity of the human body, which is in and of itself a complex system. And then women, our hormones are much more complex than men. We have monthly cycles. A lot of people in my profession talk about how women go through basically a year of change every single month because our hormones can be changing so much. And I think that there's also an expectation of women to always be on and always show up. And often nowadays we're sort of taught to shut down that menstrual cycle so that we don't experience all the things that we maybe can and should experience. I think a lot to our detriment. That kind of brings up that controversial birth control pill, right? Which can give us a lot of freedom, but in a lot of ways does have a cost that I also don't necessarily think is fully explored.
Yeah, and fully explained. I mean, informed
Yes.
consent, right? You hear it's going to help you in these ways, but you don't hear all the negatives and the cons. And I learned about that way too late. And I really wish I had someone who really understood all the cons to fully explain so I can make a better decision. I may have still made the same decision. However, I would have liked to have known that it changes your testosterone and the impact it can have in the later years of your reproductive life too.
Yeah, as patients, we all deserve full informed consent, no matter what. And again, I did learn too late, but these are conversations that I do get to have in my practice all the time is taking birth control does these great things. It also may do this. Let's figure out what works best for you in your life right now. And again, yeah, I took it. We all did. Most other women my age did because that was the thing to do. And luckily it's, there's a lot more conversation around it, which is great.
That is great. So let's pivot a little bit and talk about how can we optimize hormonal health? All the different ways. I'm sure that's a big, broad topic, but you can just start us off in any direction about ways we can optimize our hormonal health.
Yeah, I think I may choose to talk about something that maybe most other practitioners aren't talking about. There's a lot of doctors talking about exercise and sleep and diet. And obviously we know stress can play a huge factor. But what I'm noticing in my practice is that women are losing hormones earlier and earlier, and symptoms are becoming more and more common. That's not to say women haven't always really historically suffered from menopause, but now we're seeing it happen so early, kind of like what happened to me. The bigger story is actually that hormones are all tied to light. Hormones really are the story of light. And I didn't learn any of this in medical school. In the last 3 years, I sort of had a reignited passion from viewing the body from sort of a quantum biologic perspective. What we sort of learned in school is that there's sort of this physiologic set of mechanisms that happen sort of one by one. It's kind of like these pathways, this happens and then this happens. But what's actually happening is everything's happening at once simultaneously. So you have over 100 trillion reactions in one cell per second. So we can't really explain that even now with all of our, fancy AI models or things like that. There's something inherent in something so much deeper. And when I was fascinated to learn is it all comes back to light. So right now we have these devices, which are wonderful. We can keep in touch with everyone and I can not be with you in person, but I can see you and talk to you. And so these devices are great, right? We have cell phones, we have computers and things like that. What they're emitting is a specific type of spectrum of blue light that actually has unintended consequences on our biology. So whenever we look at a device or we look at our phone, we're essentially telling our body that it's 12 noon. If you look at your phone at night, right before you go to bed, you just told your brain that it's noon, and now it's expected to shut down, make all the proper hormones at night and things like that. And the body just has a really, really hard time doing it. This story didn't just start with these computers and devices. This has started sort of through our evolutionary history with the advent of electricity and lights that would essentially have kept us away from the rhythm of nature, which is that light and dark cycles. Like right now, even if you go outside at night in most major cities, it's still light outside. It's not that real darkness that we really need. And it turns out that's what cells need. That's what our body needs, is natural light during the day and then darkness at night. So when we go to our offices and we're under fluorescent lights, or our homes are full of all these LED lights and things like that, and we're not outside getting proper signals, the body really doesn't know what to do. And this is getting some more press recently, which is wonderful. I'm so thrilled about that. Another comment to make about these devices is that just looking at them will cause you to release cortisol and insulin, and you won't have eaten a single bite from food. So these are messing with some of those key hormones. Cortisol, we know, is a key hormone. Insulin, we know. I think that another interesting sort of piece of the puzzle is that hormone production really begins in the brain. So it begins in the brain with a hormone called leptin. And any type of inflammation will disrupt the leptin signaling, which is then going to disrupt insulin and going to disrupt the other hormones. So in order to make pregnenolone, which is that main first initial steroid hormone from cholesterol, we need good, healthy, active thyroid, which, so many women struggle with. We also need vitamin A, and we need vitamin D as well. All of those need to come together to create hormones. So one piece of the puzzle is we also need light into our eyes. And you and I have talked a little bit about this. I ended up needing contacts when I was, I think, around 14 years old. I was a competitive gymnast, and so I would wake up super early to go to school, like we're all supposed to do, immediately put my contacts in, be inside all day at school, go straight to practice, and I was hardly outside. And even in those times I was outside, I was wearing contacts, which are going to block UV. Turns out we need proper hormone signaling in the eye specifically, as well as on the skin, to initiate our hormones to be made. So when that happens, we create a specific protein called POMC. So POMC is called propriomelanocortin. So it's a protein that gets processed into other smaller peptides with various forms in the body. What it essentially gets broken down to is other hormones called ACTH, which helps stimulate the release of cortisol. It helps maintain your blood sugar. It's going to protect you against stress and reduce inflammation. Once these things get disrupted because you don't have proper signaling in your eye or essentially on your skin, these hormones can't be made properly. So I do suspect that the reason I had hormone issues when I was so young was because of contacts early on, not something that most people would think of. So I still have to wear contacts occasionally. I get ones now that don't block UV light, and they're certainly harder to get. And I do wear my glasses more so that I can take them off and really get light exposure into my eye through different times of the day. Other proteins that get made from POMC are going to be alpha, beta, and gamma, MSH. So these are involved in regulating weight. They're involved in producing skin pigmentation, giving your skin and eyes their color. And then there's also something called beta endorphin. So that is an endogenous opioid peptide that gives you energy and helps really balance and make you feel good. So I think some of us have experienced when we go and we lay out in the sun and we just feel so good. We just want to be lizards outside soaking up. That's actually made intentionally. So we make that hormone to drive us to be outside and to want to be in the sun. And as you can expect, that sort of goes against what we've been told, is that we should protect our skin, wear lots of sunscreen, never expose ourselves to some of these UV lights that's going to be really damaging. So the early studies that showed that UV was damaging is babies were born jaundiced, and then they were put under UV lights to help correct the jaundice. What they found in those babies was that they developed different kinds of neoplasms and different kinds of issues. And so it was deemed that UV light is damaging and harmful for all of us. What wasn't taken into account is that when we're outside, 50% of the light we're getting is not just UV, it's also infrared and red light. And there's so much talk about red light and how helpful that is. And there's all parts of the spectrum that are helpful for us. So we want to be outside as much as possible. And I know it's hard, but we should strive to do the best we can as humans. There's no need to beat yourself up if you can't be perfect. I can't in my life, but we always do the best we can and we work to change things. And so really getting the light story right really kind of avoiding things like, if you can, your contacts or your sunglasses and things like that, and really living in rhythm with nature like we were intended to do really can have such a huge impact on our hormones. One of my favorite cases that I had, and it just kind of speaks to how important this is, especially it's for people of all ages. But I specifically remember a patient in my practice, and she's maybe 14 years old and already suffering with just horrible abdominal migraines, really worse around the time of her cycle. All I did for her was have her watch the sunrise every morning, gave her a little bit of vitamins, and she had an over 90% resolution in her symptoms in only a month.
Wow.
So these are really sort of the foundations piece that, in my opinion, obviously we know exercise and stress management and healthy diet and healthy mindset, all of those things are super important. But if these foundations aren't in there, it's really impossible in a lot of ways for your body to have those initial building blocks to help you get better. One other just point that I'll make really quick is that we consider any light that's outside of natural sunlight to be artificial light. Ideally, you're using incandescent bulbs over LEDs or fluorescents. We also call that EMF field to be a non-native EMF field. There are others like Wi-Fi from the devices and things like that. And I do also encourage my patients to reduce their EMF exposure if and whenever possible, because it also can have dramatic impacts on hormones and how the cells are functioning.
Wow. Yeah. I know when we had this discussion and you were part of my Mastering Menopause program that we did together earlier this year, you have this whole sheet you really walk through with your patients, like really helping them understand these little actions, these tiny habits that they could put into their life, because without them, maybe like you were saying, diet and exercise is not going to have the impact or have the effect because it's being suppressed by too much light exposure, especially this blue light, as you mentioned, can raise cortisol, can raise insulin. And we all know that when those levels are up, it's harder for weight loss to occur. And the body may just be hanging on to weight, or people may be experiencing a weight loss plateau despite diet and exercise not really being the answer, because obesity is multifactorial. So I really like how you have this checklist for your patients when they see you and work with you, is that to be doing these small daily habits that are so foundational, so that everything else that they do on top of that really can benefit their health. If you could just give us a few nuggets. So here's what I'm hearing, and please, like, feel free to edit if I'm not getting the major concepts and the things that you spoke of, but really having some of that morning light or that evening light. I'll take my glasses off to do that, right? To really get it into the eye, because I need to make this palm C that is so critical to downstream hormone production and balancing my hormones throughout the day. I know if we get in that morning sunlight, particularly, that also signals melatonin, right? And keeps that regular. But what other, and please modify that if it's not what I exactly summarized from you, and what other modifications or things that you do personally that are just some of these small habits that we can put into our lives?
Yeah, great question. So I really try and encourage my patients to, as much as possible, lead a circadian life. The number one thing that I want my patients to do and that I do every day is I watch the sunrise, no matter where I am. I put my bare feet on the ground. And what that allows us to do is to allow the ATPase in the electron transport chain to spin clockwise so that we make energy efficiently. Throughout the day, I try to be outside as much as possible. If that's not possible, I'm cracking my car windows, I'm cracking doors whenever possible. I'll put sort of 2 layers of protection on my devices. So again, I'm changing screens or downloading different apps. And then I'll oftentimes wear different blue light blocking glasses and things like that, especially after the sun goes down. I also time my meals in a circadian manner. So I eat within 30 minutes of waking up generally. I make that breakfast my largest meal. If I'm going to have sweets, I do it then, ideally. I'm not perfect. And then my lunch and my dinner are smaller, and I never eat after the sun goes down. And you and I know that that gets earlier and earlier, but it's an extra good type of stressor for us so that we're getting some fasting, but we're doing it in a circadian manner. I do my best to manage my stress. Absolutely not perfect, because that's going to impact everything. If you are super stressed, and I know so many of my women are, I'm usually advocating for them to say no to more things so that they can have a lot of self-care time. So not over planning, not overextending yourself, really making sure that you are doing self-care and having time where you can just be quiet and be with yourself to really also listen to your intuition and your heart and your body and what it's telling you. One sort of thing that I made the mistake of is a lot of times my body was sending me signals and I just shut them down. And a lot of it was survival because I had to get through school or, work, yada, yada, yada. But whenever we can, we want to sit and be quiet and listen to our bodies because oftentimes the signal will be small in the beginning, but it will get louder and louder. Ideally, we're preventing disease instead of treating it. I also utilize some cold exposure, which I used to hate more than anything, but I have what's called a J haplotype, which means I'm from Northern European heritage. And that means that my mitochondria are basically made to adapt to cold. So I'll jump in the ocean when I can. I have a cold plunge at home. I'll try to do longer exposures as opposed to the 2 to 3 minutes of really cold. I'll stick to the more 50 to 55 degrees when I can. And really spend as much time in there to really focus on mitochondrial health. I've noticed that when I do it, it really affects my sleep. So sleep is likely due to that inflammation and lack of signaling in the brain, the rays of something called TNF alpha. Any type of inflammation in the brain is going to impact your hormones. So I utilize that to help keep my inflammation low. Another thing that's sort of new to my practice and that I've been doing myself is something called V-cell therapy. So these are called very small embryonic-like stem cells. These stem cells, they're essentially dormant. So they don't age at the same rate that the rest of your body does. They age at about 1/10 of the rate. So what I do in my practice is we are able to take them out with a simple blood draw. We activate them with a special type of red light laser, and then we're able to give them back to you. What's unique about these cells is they're your own. So there's not a lot of risk there. They also are able to differentiate into any type of cell, and they can cross the blood-brain barrier. Oftentimes, they're going to go where the inflammation is. And so we try to do the work to clean up the inflammation, and then we actually use the laser to try to adhere these specific type of V cells where we want them. Treating myself, I saw a major change in my own hormone production, which is huge. In general, we're treating aging, right? So what we see is that women and men's hormones improve. We've seen testosterone in men increase 200 to 400 after just one treatment. And we've had a lot of success with women with infertility issues. So helping patients in those sort of ways as well, I've also seen really, really move the needle. And so my goal, hopefully we will see, but my goal is to try to get my own hormone production again and really, really live these principles and see if I can do it.
You certainly are an example of what is possible, Dr. Etzel. And I just applaud the work that you do. It's so cutting edge, this new stuff that you have been telling me about. I've been looking at it and researching it after our discussions together. And it's really fascinating on how the body begins to respond when you treat it with the right proper tools like light therapy, the proper hormone balances, and how the body wants to be in homeostasis and wants to be healthy. The body really wants to do that. And we keep making our environment more inhospitable to our bodies working and optimizing and functioning that way. Cold plunge, I love that you do it. Not sure I could get behind it. I don't like being cold. What are your thoughts? Do you have any thoughts about sauna use or even red light therapy?
I like sauna. I love red light therapy. You want to make sure you're getting good devices there because a lot of the saunas can have EMF exposure, and then the red lights, you want to make sure there's no flicker. So it's not just sort of the abnormal light that's in our devices. A lot of them have a flicker. I don't know if anyone has ever sort of taken a slow motion video of their lights at home or their computer, and you'll notice a flickering. And so we don't see it with our eyes, but our nervous system notices that as well. And so that can be disruptive. So you want to make sure you're getting good products. One thing I do like to talk about with cold exposure is that anything less than 98 degrees is going to be cold exposure. So even if you decide in the morning, when you're outside, if you decide, oh, I'm not going to put my heavy jacket on, I'm just going to wear sort of a light sort of sweater and just experience a little bit of cold. That's cold. That's cold therapy. That's really helping you. And I go over a lot of the additional benefits of utilizing that brown fat will also help us make T3 and T4, have good hormones there. And so it can be used, and you don't have to go to the extremes. You don't have to jump in ice baths every day and get super stressed. And again, listen to your body. And one thing we know is it will adapt over time. That's what we do as humans better than anything, is adaptation.
Yeah, beautifully said. Beautifully said. Well, Dr. Etzel, this has been great. And I know you have a caseload of patients to get back to, so I want to be respectful of your time. But please tell my audience, if they want to find you and work with you, where should we send them?
You can reach me through my website. You can email me through my website. I'm at wildintegrativemedicine.com. You can Google my name, and my email is actually KendraEtzel, the letter N, the letter D, @gmail.com. So you can reach me that way. Ask me any questions, and yeah, I'm happy to help. Thank you so much.
Dr. Etzel, such a pleasure. You are a fabulous resource. I really appreciate the work you do for all the women and for me. And it's so good to call you a friend. Thank you for coming on today's podcast.
Thank you. I appreciate you more than you'll ever know. You make my job so fun, you and all my patients. Thank you for being so wonderful.